Hello, my name is Chantel Graham with Advanced Health Assessment Fall Semester 2022. I'll be doing my head-to-toe assessment on Leia, and Dylan will be filming it. He will scan the room, all the walls, tabletops, and floors. Okay, so throughout the exam, I will examine the skin of the face, head, neck, posterior chest, anterior chest, and abdomen for color, temperature, moisture, texture, turgor, edema, scarring, bruising, lesions, and nevi. I will inspect the head for midline position, symmetry, and size. I will inspect and palpate the scalp for hair color, distribution, and texture. I will palpate for any masses, lesions, tenderness, depressions, and I will inspect for infestations. Then we will move on to palpating the bilateral temporal arteries for tenderness. Any noted?
No.
Okay. Then we will move forward with palpating the lymph nodes of the face of the head and neck. So I will begin with the pre-auricular, post-auricular, then I will go to the occipital, tonsillar, submandibular, submental, the anterior cervical, posterior cervical, and supraclavicular lymph nodes. We will now assess for the trigeminal nerve, cranial nerve number 5. First, sensory, so you just tell me where I touch, close your eyes.
Forehead, nose, cheek, chin, other cheek.
Okay, now we will assess the motor function of the trigeminal nerve, cranial nerve number 5 by having you clench your jaw. Good job. Okay, then we will assess we will assess the facial nerve, cranial nerve number 7 by having you smile, frown, raise your eyebrows, puff your cheeks, and pucker your lips. And I will also assess TMJ for any tenderness and subluxation. I'll have you open your mouth, close your mouth, or move your jaw from side to side. Okay, any tenderness?
No.
Okay, so now we'll move on to inspecting the ear for shape and position. I will use my otoscope to inspect the ear canal for any drainage and to inspect the tympanic membrane by pulling her ear up and back. I've observed the tympanic membrane is intact, pearly gray. The light reflex is present. Then for the other ear, I will do the same. Pull her ear up and back, inspect the ear canal, no drainage, no redness, and the tympanic membrane is intact, pearly gray, and the light reflex is intact. We will assess cranial nerve number 8, the vestibulocochlear nerve, by first performing the whisper test. So occlude your ear. Repeat back to me what I whisper to you.
1, 2, 3.
The other ear, please.
ABC.
Good. Now we will perform the Weber test for lateralization. You just tell me if you can hear it in both ears.
Yes, I can.
Okay, now we will do the Rin test. Tell me when you cannot hear it.
No.
Can you hear it now?
Yes.
Okay. Tell me when you can no longer hear it.
Now.
Can no longer hear it.
Now.
Good job. So now we will move on to inspecting the nose for midline position and symmetry. I will now assess for your patency, so I want you to occlude one side and breathe in and do it to the other side. Okay, close your eyes for me. We will assess cranial nerve number 1, the olfactory nerve. Deep breath in. Okay, what do you smell?
Alcohol.
Okay. What do you smell?
Vicks Vapor Rub.
Okay. All right, and I will palpate. I'll need you to remove your glasses. I will palpate your maxillary and frontal sinuses for any tenderness. Do you have any tenderness?
No.
Okay. So we will move on to your eyes. I will inspect your eyelashes and your eyebrows and your palpebrae fissures, and I will also inspect your conjunctiva and sclera for any redness, lesions, and drainage. There are none. We will assess cranial nerve number 2, which is the optic nerve. So I'll have you cover one eye and read the smallest line that you can see.
L H2TFPH.
Okay, so 20 vision in the left eye.
And LTFPH.
Okay, 20/20 vision in the right eye. So we will move on to assess your peripheral and central vision. So include the same eye, there you go. And just tell me when you can see my fingers.
Now.
Okay,
Now.
okay,
Now.
okay, good. Let's do the other side.
Now.
Okay,
Now.
okay,
Now.
okay, good. All right. So we will assess for accommodation and convergence. So look at my nose and follow my finger to your nose. Okay, convergence is intact and accommodation intact. We will now assess cranial nerves, number 3, your pupillary response for direct and consensual pupillary response. So remove your glasses and we'll turn the lights out. Okay, so just look at me. Okay, there was direct and consensual response with that pupil and also with her right pupil. We will move on to assess for the right reflex. Okay, present in that eye and present in her right eye. Also inspect the internal eye structures. Okay, no wool spots or nicking noted in that eye. No wool spots or nicking noted in her right eye. Okay, so we will move on. We can turn the lights back on. All right, we will now assess for cranial nerves number 3, 4, and 6 of the extraocular movements of the eye, which is your oculomotor, trochlear, and your abducens nerve. So just follow my fingers with your eyes, okay? Okay, good. This side. Okay, good. All right, so we will move on to assess the throat and mouth. And I will have you open your mouth. I'm going to assess the lips, teeth, gums, buccal mucosa, tongue, posterior pharynx, under the tongue, raise your tongue, good. The salivary ducts, good. And I will assess the palate, and I will have you stick out your tongue and say ah.
Ah.
Okay, cranial nerves numbers 9 and 10 are intact, which is the glossopharyngeal and the vagus nerve. The uvula and the soft palate raised symmetrically with phonation. Stick your tongue out. Okay, thank you. Cranial nerve number 12 is intact, which is the glossopharyngeal. No fasciculations noted. We will move on to assess the neck. The trachea is in the midline position. I will assess your thyroid gland. So I'm going to displace your trachea and I'll feel your thyroid. Swallow for me. Okay, we'll do it on this side as well. Swallow. Okay, no nodules or masses noted. We will now move on to, I will palpate your carotid arteries, one at a time. Okay, and now I will auscultate with the bell of my stethoscope your carotid arteries for any bruits. Okay, no bruits noted. So now we'll move on to assess the posterior chest for any signs of respiratory distress, including any tachypnea, any nasal. We'll also assess for any nasal flaring, no nasal flaring, tachypnea, retractions, use of accessory muscles, and cyanosis. I will assess for symmetrical chest expansion. So I'll have you take a deep breath and let it out. Okay. I will palpate for tactile fremitus, so say 99.
99, 99, 99, 99.
Good. Okay, I'm going to percuss for any tympany, dullness, or flatness. And I will auscultate the breath sounds beginning above the scapula with the diaphragm of my stethoscope. Being sure to auscultate the lateral aspect of the lung for the right middle lobe. Okay, and now I will auscultate for egophony. Say E whenever I place the stethoscope.
E, 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 E.
Okay, now we will assess for bronchophony. Say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, now we will assess for whisper pectolorically, and I need you to just whisper 1, 2, 3.
1, 2, 3.
Okay, so now we will move on to the anterior chest. Inspecting again for any signs of respiratory distress, no nasal flaring, no cyanosis, retractions, or use of accessory muscles, no tachypnea. So when I touch you, say 99.
99.
Palpating for tactile fremitus.
99, 99, 99.
Okay, and now I will auscultate the anterior lung sounds. Okay, again, being sure to listen to the lateral lung sounds for the right middle lobe. Okay, so now we will auscultate your heart sounds, and I will begin with the diaphragm, and we will start with the aortic heart sound, which is second intercostal space, right sternal border. The pulmonic, which is the second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, third intercostal space, left sternal border. The mitral, which is the fifth intercostal space, mid-clavicular line. I will auscultate the apical pulse for a minute, noting the rate and rhythm. Apical pulse is 72, normal rate and rhythm. And I will palpate the PMI to note that it is not displaced. I will now auscultate the heart sounds with the bell, aortic, pulmonic, Erb's, tricuspid, and mitral. I will have you lay on the couch for me so that we can assess your heart sounds lying down. I will have inspect for JVD and pulsations. There are none noted on either side. I'll now palpate the auscultation points of the heart for any thrills. The aortic, pulmonic, Erb's point, tricuspid, and the mitral. There are no thrills noted. I will now listen with the diaphragm of my stethoscope at the same point, which is the aortic, pulmonic, Erb's point, tricuspid, and mitral. I will then do the same with my bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, so now we'll move on to the abdomen, and I will inspect the abdomen for contour and symmetry. I will also auscultate arteries in the abdomen with the bell of my stethoscope. So I will auscultate aortic, renal, iliac, and femoral, which for privacy reasons we will keep her closed for this, and under usual circumstances I would do this on her skin. I will now auscultate with the diaphragm of my stethoscope her vowel sounds starting at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. We will now percuss for any tympany, dullness, and flatness of the abdomen. Okay, and I will now palpate the abdomen for any masses or tenderness, starting in the right lower quadrant, right upper, left lower. And now I will palpate the liver. I'll put my hand up under here for you, okay? Just relax for me. Okay, take a deep breath. Okay, the liver is not palpable. And I will palpate the spleen. Okay, the spleen is not palpated. Okay, so now I will have you go back to the chair and sit for me. And we will assess for CBA tenderness. Excuse me. So just tell me if you have any tenderness.
No.
Okay.
No.
All right, good. So now we will move on to assessing the musculoskeletal system. I will start by inspecting and palpating the joints of the shoulders, elbows, wrists, and fingers for any redness, swelling, tenderness, any masses, nodules, crepitus, and symmetry. We will start, I'll palpate her radial pulses, 2+. Check her cap refill, less than 2. We will move on to assess the range of motion. So I will have you, we'll start with your hands, your fingers. So I'll have you flex, extend, hyperextend. Then I need you to abduct, adduct, and thumb opposition. Good. Let's move on to the wrist. Flex, extend, hyperextend. I want you to do radial deviation, ulnar deviation, and then rotation. We'll move on to the elbows. We will flex, extend, hyperextend. Good. We'll move on to your shoulders. Flex, extend, hyperextend. And then I will have you abduct, adduct, and I will have you do circumduction. Okay, good job. Then we will move on to, let's do the internal rotation, external rotation, and switch. Good job. All right, so now we will move on to testing the strength. So I'm going to have you squeeze my fingers. 5 out of 5 grip strength. Assess the bicep and tricep strength. So push down on my hand. Good. Now push up. Pull up, push up. Good. Let's do this side. Push down. Pull up. Good job. 5 out of 5 strength bilaterally for the bicep and tricep strength. Then we will assess the shoulder strength. So I want you to abduct and adduct your shoulders. So we will do that. I'll have you, pull out. Okay, now push in. Good job. 5 out of 5 strength with shoulder abduction and adduction. Then we will assess cranial nerve number 11, the spinal accessory nerve. Shrug against resistance. Cranial nerve number 11 is intact. We will now move on to assessing the cerebral coordination. So I will have you on both hands. So your this, finger, okay. Then I want you to do the flip-flop, both sides, okay. And then I want you to touch your nose and then touch my finger. Good job. Okay, so now we will move on. I will assess her upper and lower extremities for skin integrity, color, warmth, and edema. There is no edema. Skin is warm and dry. And we will move on to assess for her, assess stereognosis. So I'll have you close your eyes. Okay, open your hands and tell me what's in that hand.
A cotton pad.
Okay, tell me what's in this hand.
A pen.
Good job. We will now move on to assess for graphesthesia. So I'm going to draw in your palm of your hand and you tell me what I'm doing, what I wrote.
1.
Okay.
B.
Good job. Okay, so now I will assess sensory, light touch. Close your eyes and tell me where I touch you on your extremities, please. We'll pull your pants up. Okay,
My arm,
which arm?
my right arm, left arm, left shin, right shin.
Okay, good job. All right, and now we will assess for the vibratory sensation. I will assess the ulnar prominence.
Yes. Yes, I can feel it. Yes. Yes.
Okay. So I will now go on to the lower extremities, and I will assess her dorsalis pedis pulses and her posterior tibialis pulses 2+. Calf refill in toes are less than 2. So I will now have you, let's do your toes. Let's do flex, extend, hyperextend, abduct, adduct. Okay, let's do your ankles. Dorsiflex, both of them. Plantar flex, good. Okay, and then I will have you inversion, eversion, rotation. Okay, now let's assess for strength. So I will have you push down, good, both sides, good. Pull up, okay. 5x5 strength for plantar and dorsiflexion. We'll assess the strength of the knees. So push out, good. Pull in, good. 5x5 strength for the knees. Now we'll have you stand up, okay, and we will assess the range of motion for your hips. And I will have you, we will do your, we will do flex, flex, extend, hyperextend, okay? Then we'll do abduct, adduct, circumduct, okay? Then we'll do the same over here. We'll do flex, flex, extend, hyperextend, abduct, adduct, circumduct, okay? We will do internal rotation of your hips. So internal rotation, both sides, okay, and external rotation, this way.
Oh.
There you go. Okay, so now we will do your knees. We'll do flex, extend, hyperextend. Let's do this side, flex, extend, hyperextend. All right, so we will now assess the spine. So I need you to just lean over, and we are assessing the spine for any masses, tenderness, and curvature, noting any abnormal curvatures or scoliosis. There's none. Stand up. We'll assess the lumbar spine. So I need you to, again, with your lumbar, flex, extend, hyperextend, lateral extensions, rotation. Okay, we'll do the same for the cervical spine. We'll do flex, extend, hyperextend, lateral extension, and rotation. All right, and so now we will assess your Romberg. So close your eyes, and I need you to put your arms out. Good job. All right, now we will assess your gait. I need you to just walk normally. Then we will assess the tandem gait, so heel to toe. Okay, now turn around for me. Hop on one foot, and then hop on the other. And I need you to take a seat because I need to assess your reflexes, which, sorry about that. We'll assess the brachioradialis, the bicep, tricep, patella, okay, the Achilles, okay, and the Babinski, okay. Same on this side, the brachioradialis, bicep, tricep, okay, patella, okay, and the Achilles and Babinski. And that's the end.